So I was cut off there a bit, but what I was talking about was I usually would mix the codeine with the Tylenol, and that kind of masks the codeine taste. Real good tip. Other medications that you could use, I did get sick the one night, and I did vomit, and so Gravol, really important. Or something for nausea. I also have another medication that I crushed up and took, and that works really good. Then Sudafed, something for sinus congestion. That's important too. And I was in the hospital, they gave it regularly. And when I got home, I took it, I think the first day maybe. And then my congestion wasn't that bad. Well, it's bad. I shouldn't say it's not bad. It is bad, but, it's really, I can still breathe. I have a humidifier going 24/7, and that really helps. But, I'd say for nighttime, definitely you want to take something Sudafed for your congestion. This is from the hospital. It's a spray, nasal spray, and that also helps a little bit, but I don't know. It's not that good. For nighttime, for the first couple nights, I actually took a Tylenol with the nighttime medication. And I don't know if that was a good idea, because the codeine makes me a little drowsy. And then the nighttime medication and Gravol is just, you feel out of it. Yeah, so just regular Tylenol, ibuprofen is probably all you need. And just stagger it. So, you're not, because I was sore by the 2 hours initially when I got home. I was happy to take something for pain by the time the 2 hours came. So, just be watching your total doses for your 24-hour period, because it's easy to go over. Yeah, that's kind of the main things. What else? Oh, I was going to talk about, yeah, it's a kind of a funny subject, but my poop. Constipation. Oof. I didn't have a bowel movement for 4 days after the operation. And, I mean, in the beginning you're not really eating, you're just having fluids, so, fair enough. But afterward, I was eating every 2 hours, and not everything had fiber, but I was putting in ground flaxseed in a lot of stuff, and I was taking fruit juice almost every time I was eating, just 160cc syringe full. And, yeah, I felt really full, and when I wasn't going, and I think because I was nervous to create any pressure, because your head's so full of pressure, and they warn you, don't do anything to increase pressure, because you could bleed. So I was kind of paranoid, so that didn't help. But what did help was just a tea. So I've got a senna leaf tea, and senna leaf is a natural laxative, so I would definitely say get some, because I never have a problem with constipation normally, but it wasn't fun. And, yeah, so just something to keep in mind. Food, I've been actually eating, again, because my mom's here, she's been helping with food. What's really good is roasted vegetables. Just a big pan, roast up vegetables, carrot, celery, pepper, and potato, and then roast it for a while. And then with chicken broth, blend it, and that tastes really good. And I find I'm already sick of sweet things. Things like ensure and pudding, and it's just, I'm kind of sick of it already. I don't have a weigh scale, so I'm not sure if I lost any weight, but I think I have, and I think I really probably lost muscle mass more than anything. I have some resistance bands I'm going to start doing some things with, but I'm going to take it easy still. yeah, I don't regret anything right now at all. Uh, I think I'm really lucky with how everything turned out. I pray to God I don't get an infection, and I hope I'm past that by now, but you never know. Um, I guess time will tell. I'm actually going to see my surgeon tomorrow, and he's not going to do anything. It's really just the first follow-up. Gonna look at my teeth, but he said he's not gonna cut the bands or anything. That'll be next week that he'll do that. 2 weeks post-op, he said he'll cut, and then I'll just have guiding elastics, so I'll be able to open my mouth. Speaking of elastics, one elastic did break. I just was touching. It was like the first day I was home, I think. I just kind of touched on the elastics, and it was a little snap, nothing big. And then I went to the bathroom and looked in the mirror, and there was one elastic. So you can see this has all the elastics, and I'm missing elastic. I think it was from there. It could have been further over because I kind of had a space. Yeah, really just the day goes by pretty fast when you're having to take all your medications and stuff, but I'm getting bored, but I know I'm not well enough to really do much, so it makes it easy. Sleeping, I'm sleeping on the couch with a bunch of pillows, and I have a neck pillow, which I would definitely recommend getting a neck pillow, or, something for neck support. But, I tried to sleep in the bed last night, not flat, but propped up, and I found that I was having a lot of anxiety last night for some reason. With this film in my mouth, I felt like I couldn't breathe, and so, I don't know, and I was congested, and I don't know, it was just not a good night. So, I actually moved back out onto the couch. Yeah, so, do whatever is most comfortable. I can't wait to lie flat, though, that's for sure. What else? I can't really think of anything else to say right now. It's still kind of surreal to be here, and when you look at your teeth after in the mirror, and how everything finally aligns, and you can see that it's gonna be awesome when you can take a bite of something. Yeah, I'm just so happy. I can't wait to bite into something, a sandwich or something. Oh, yeah. I'm hungry though, so oh, hunger. I actually only been hungry for the last 2 days. The first few days when I got here, I never felt hungry at all. But I think it's because I was drinking so much fluid regularly. Now, I'm getting hungry. Every few hours, I feel really hungry. And it sucks, because I think I'm pretty cranky. So, just gotta keep creative. Well, it's helpful to make a little schedule for yourself. So, you can see I had the hours, and then I write down the medication. This is an old one. It's not the one I used to do. And then I was writing down my fluids on the side, because I was told I should get, well, my surgeon didn't really care. He was just like, oh, drink whatever. But I've read that you should have 3 to 4 liters of fluids per day if you're on a fluid diet. And so I've been able to keep that up pretty easily. So, I use separate syringes for the water, sweet things, and savory. So any foods that are bland, savory, just keep them separate. I find the syringes get kind of stuck, and they get harder, so that's kind of a pain. What else? I spilled down my face, but it's getting better. It's not that bad. Yeah. So far, everything's going really good, so, I might update after. I don't think anything major will happen for my appointment tomorrow, so I don't know if I'll film anything. I never really planned to film anything in the first place, so I might not even post this on YouTube, but I know how helpful it was before the operation. So anyway, yeah, until next time, and every day just things get a little better, and definitely on the mend now and feeling better now. And but it's not a easy thing. Yeah, I think when I'm able to talk better, I will go into kind of my pre-op stuff and how long I was in braces for and all that type of thing, my story a bit more, but it's just too much to tell when you're bandaged shut. So, anyway, yeah, thanks for watching.